I'm Dr. Chip Levy. I'm Professor of Medicine and Medical Director of Cardiac Rehabilitation and Preventive Cardiology here at the John Ochsner Heart and Vascular Institute, Ochsner Clinical School, the University of Queensland School of Medicine here in New Orleans, Louisiana. And I'm here to discuss our manuscript entitled Promoting Health and Wellness at the Worksite, a unique opportunity to establish primary and extended secondary cardiovascular risk reduction programs, which we published in the June issue of the Mayo Clinic Proceedings. I'd first like to acknowledge and congratulate the excellent work of my esteemed group of 10 co-authors from around the globe, including Italy, Brazil, India, as well as the United States, and particularly the efforts of the first and lead author, Dr. Ross Arena, who's recently become the Department Chairman of Physical Therapy at the University of Illinois in Chicago. I think it is clear to most people that cardiovascular disease represents by far the leading cause of morbidity and mortality in almost all of the Western world and produces huge economic impacts on our societies. At least in secondary coronary prevention, cardiac rehabilitation and exercise training programs, which are themselves grossly underutilized, have been demonstrated to significantly improve coronary risk factors, especially levels of cardiorespiratory fitness, but also to reduce subsequent major cardiovascular morbidity and mortality, and in the long run to also reduce healthcare costs in those who participate. Now, many believe that this would also apply to primary prevention programs, but demonstrating this has been somewhat harder to come by. But in our current era of skyrocketing healthcare costs, as well as the climate of healthcare reform and Affordable Care Act legislation, we may now, in the very near future, have some unique opportunities to better establish and promote primary and secondary cardiovascular preventive programs. Certainly corporations such as those in the United States understand right now the very huge premiums that they are paying for the health care for their employees. And these costs are skyrocketing, placing a toll on their businesses. Therefore, implementing health and wellness programs in the workplace provides a unique opportunity to engage a large number of employees with the primary goal of promoting an improvement and a sustainable improvement in adverse lifestyle choices, with the ultimate goal of improving coronary risk factors, reducing subsequent cardiovascular morbidity and mortality, and in the long run, what's very important is reducing healthcare expenditures. So in our manuscript, we review the large body of evidence on the efficacy of health and wellness programs in the workplace and the evidence for developing and implementing these programs with the sole purpose of the primary and secondary prevention of cardiovascular diseases. For example, one of the articles that we reviewed is by my colleague at Ochsner, Dr. Richard Milani, and I, in a paper that we published a couple of years ago in the American Journal of Cardiology, where we used cardiac rehabilitation staff to go out to the workplace and establish a health and wellness program. And following intervention, we demonstrated significant improvements in body fat, blood pressure, plasma lipids, adverse behavioral characteristics including depression, hostility, anxiety, and somatization, improvements in total quality of life and overall healthcare scores. But more importantly, in those individuals who were identified to be high-risk employees for high health risk at the beginning of the program, following intervention, about 60% were converted to low risk with huge healthcare savings. Now, certainly showing financial rewards is a very important way to judge the success of health and wellness programs at the worksite. In general, the literature suggests that for every $1 spent in health and wellness at the workplace, there's almost a $3 return in investment, so very cost effective. But in addition to this, there's significant improvements in absenteeism, presenteeism, and combined all of this significantly improves the overall workers' production. Additionally, there are reductions in sick leave days, total health claims, disability claims, workman compensation claims. All of this adds together to produce significant benefits in the bottom line for the corporations. Additionally, there's the benefit of better job satisfaction and employee morale, which overall improves corporate image and in the long run can actually help with the recruitment and retainment of valuable, skillful employees for the workplace. So in our manuscript, we discuss and explain how to develop and implement a wellness and health program at the workplace with attention directed at personnel requirements, screening and identification of high-risk employees, and ways to reduce physical inactivity, smoking, obesity, adverse psychological stress, poor nutritional choices, and other adverse lifestyle choices, all with the idea of eventually improving coronary risk, reducing cardiovascular morbidity and mortality, and very important to the corporations, reducing subsequent health care expenditures. So in conclusion, in our manuscript, I think we review the evidence that health and wellness programs in the workplace significantly improve the cardiovascular health for employees, which is a very large segment of our society. But not only is the cardiovascular health of the employees improved, but by trickle-down effect, the health of their family members is also improved. Considering the overwhelming burden that cardiovascular diseases places on almost all aspects of our society, I think it's time that we should rethink the potential role of health and wellness programs at the workplace for the primary and secondary prevention of cardiovascular diseases. Thank you.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.